Erika. How's everything going today?
Good, thank you.
Good. It's nice to have you in the office again. Looks like this time we have you in for a bit of a specialty assessment. Okay, so I'm just going to go ahead and open your chart. I was reading up on what we had going on earlier. Okay, so it looks like you've had some kind of inflammatory symptoms, a little bit of swelling in the nodes. Okay, let's see. Also saw that there were some notes about some possible tingling or numbness, and you're not quite sure if the two are related. Okay, so I'm definitely going to look into that. Let's see. I had some time earlier. I was looking at your chart from your previous assessment, and it looks like we did a thorough head to toe, and there was nothing really that was concerning. So this is fairly new, aside from your chronic fibromyalgia. So I do have that noted. Doesn't look like there's been any changes there. Have you had any emergency appointments in between now and your last appointment?
No.
No. Okay, good. And then as far as your symptoms today, have you had any illnesses recently? Any like viruses or sickness? Anything that you think would be causing some of that inflammation?
Just like a sore throat.
Sore throat. Okay. Sore throat. Any fever?
No.
No fever. Good. All right. Now, Sarah did take your vital signs, our medical assistant, and it looks like everything was fine. Maybe some very mild hypertension, but I do see that that's kind of in your medical history as well. All right, let's see. Okay, so I did see a note here. It looks like some of that tingling is kind of isolated to your face. And then do we have any like going down the neck or going down the arms?
A little bit on my left side.
A little bit on your left side. Okay, so left side of the face. Anything in your legs? Do you feel like it's gone down further in the body? Your legs feel okay? Nothing that you've noticed? All right. Any pain associated with that? Any like sharp stabbing pain, throbbing, dull pain? No, good. Okay. All right. So I'm going to perform a physical assessment. I'll go through a couple things, test a couple of your cranial nerves and kind of the function of your brain essentially, and then definitely test some sensation, see if there's anything we need to rule out there. Do some palpation and just kind of feel around your face, feel around your head. We'll pay some attention to that left side if I think something's more concerning. Okay. All right. So aside from that, is there anything else you wanted me to have a look at today?
No, I think that's it.
Okay. So it has been about a year since your last general assessment, so I will work some of that in today and just do kind of an overall physical assessment. And then, of course, we'll focus on the things that we're a little bit more concerned about today, so that's totally fine. Just saves you from having to come back in for your annual. Okay. All right. So I'm just going to go ahead and cleanse my hands and we can get started. Now, since the last time I saw you, have you been keeping up with your ancillary appointments? So like your optometrist and your dentist, you've had all of those. Did your glasses prescription change at all since your last appointment? Okay, so all of that is the same. We'll probably do just a brief test of your visual acuity, just make sure all of that's fine. All right, so let's go ahead and get started. I think to start with, I'm just going to kind of have a look and see if there's anything that I'm noticing, okay? So I'll have you just kind of relax for me. I'm just going to kind of have a brief assessment. I'm just going to look at the overall state and kind of external well-being. So just looking at your face and just kind of the overall structure. I like to look at the brows and eyes, look for any sort of misalignment or asymmetry. Specifically around the mouth, we like to look for any drooping. That looks okay. Don't notice any misalignment at the shoulders. We're fairly even there. Elbows are midline with torso. Legs as well are even. I don't notice any dropping of the feet. That looks good. All right. Okay. So let's go ahead and go in with our light. And I'm just going to start by having kind of a more in-depth visual assessment, So I'm going to move your hair just a little bit and kind of peek around. You're welcome to close your eyes or keep them open, whatever's more comfortable. It is fairly bright. Not shining it in your eyes directly at this point. I just kind of want to have a look if there's any abnormalities of the skin. Again, brow hair good, nice and full. Lashes are nice and full. Overall skin complexion is nice and even. I don't notice any sense of redness or erythema. There's no rosacea. It's mild pink at the nose, which is normal. Just blood flow. Lips are a good color. Don't look overly pale. I don't notice any signs of blueness or lack of circulation there. So also just having a look at the thyroid. I like to look for any signs of swelling. Of course, do some palpation. As you said, this is where you had some of that inflammation, but I don't see any abnormal pulsation or any protrusion there, so that looks good. Okay. And I'm just going to have a look at the upper extremities. I'll just take your arm here. I'm just going to have a look at the skin. We did do a skin assessment in your last examination, and your tattoos all looked normal. You do have a fair amount of freckles and moles. Do you ever see a dermatologist and just have everything looked at? Okay. Beautiful nails, very well groomed. Nice and clean. I don't notice anything abnormal there. So if you flip your hand over for me, I'm just going to have a look at the palm. No signs of redness or excess moisture. That looks good. Okay, all right. And then I'm just going to look at this left side. Now, you said you noticed some of that kind of abnormal sensation on the left side of your face. Anything on the arm as well, or is it?
I just kind of get goosebumps on the left side, just randomly.
Okay. And there's nothing you've noticed that kind of makes it worse? Okay. Don't notice any swelling or anything on this side? Okay, all right, that looks okay. All right, so let's go ahead and continue. Before I start with any palpations and just kind of start touching you, I'm going to take a couple places for your temperature. I just want to see if there's anything concerning there. So I'm going to start here at the neck. So I'm just going to test kind of behind the ear. So look like there's actually a little bit of variation. Normal temperature here at the front, but as I come here, maybe just a tad warmer by the ear. Okay. So I'm just going to check at the forehead. Definitely a little bit of warmth there, so just a touch. It is bilateral, so could just be that we're looking at some sort of mild inflammation. Maybe your body is trying to fight a virus. Coming into summertime, there's a lot of pollen in the area, so all of that could be a factor as well. I'm just going to test the arms as well. Okay. So, doesn't look too bad. Temperature of the arms is very consistent. I do just want to check here a little bit more precisely at the thyroid, 98.3. Okay, 98.3. So an average normal temperature reading there, so that's okay. All right. So let's see. Let's go ahead and get a couple things out of the way. I'm going to have a look in your eyes. So, firstly, going to test for normal pupillary constriction and dilation. Are you comfortable removing your glasses? Okay, so I'm going to shine this light in your eyes. It is fairly bright. I do apologize there. I know you're familiar with this examination. So I'm just going to have you kind of look at me, nothing super specific, and then I want you to focus on the light here and just keep your gaze there for a second. So just line a test. response to light as it comes in. Checking for consensual and independent response. So direct and consensual. Just going to come in from the side. Very healthy response of the pupils. As I do a bit of a faster motion here, I'm getting normal response. I also have a little card here that I can use. So I'm just going to cover one eye here. Very healthy independent response there. I'm going to have you follow the light for me. So I want you to keep your head fixated. You'll see a point on the wall there. I want you to look at that point. Try not to move your head. And now you're just going to follow the light with your eyes. Very good. Just follow with your eyes. This is testing motor function, your brain's ability to move your eyes. So we're going to come out. And we're going to follow that all the way in. Good. Okay. So I'm going to hold out an object here. I want you to look at this for me, and then look at the light. Good. And then look at this. And look at the light. Very good. Switch hands here. So I want you to look here. And look at the light. And look here. Okay. Very good job. So your pupillary constriction and dilation was normal, so your eyes are moving to light accordingly. So before I allow you to put your glasses back on, I'm just going to have a look in your eye with my ophthalmoscope. So this device allows me to have a magnified look inside of the eye. Just gonna look here. So I'm going to have you look here. You're going to keep your gaze here for me. I'm going to come in and I'm going to have a look directly in your eye, okay? So I'm going to start here. Just going to gently hold your eye open. And I'm going to come very close to your face. I'm just going to have a look directly in your eye. Looking at optic disc, ocular health, just looking at the anatomy of your eye. No signs of retinopathy. I don't see any corneal dysfunction. I'm going to hold down at the lid and have you look up for me. No signs of abnormal mucosa, normal pinkening. And I'm going to have you look down. Very good. Okay, nice and healthy on that side. So now you turn your head towards me and we'll have a look at this other side. Good. So same thing, I'm going to come in. Coming in from this side. Optic disc is visualized. Signs of tearing. Have you look down for me, Erika? Maybe some mild inflammation there. Go ahead and look up. Any pain or tenderness here on the left side? No? Okay, alright. So I did see a little bit of inflammation on that left side, so I'm going to look in that a little bit further when I come over on that side of the table. So I'm just going to take a quick note. You can go ahead and put your glasses back on if you'd like. Let's see. So left ophthalmoscopy, mildly otoscope. So I do see some inflammation, some mild corneal distension. Have you had any like scratches or anything or anything stuck in your eye? Just allergies. Okay. Okay, so that sometimes we might accidentally just cause like a mild abrasion of the eye. It can cause some swelling, so I will have a look and see if there's anything more concerning there. I did just notice just some mild inflammation, so I'm just taking a quick note here. All right. Okay. All right. So we can go ahead and get a couple things out of the way with your eyes. I have, let's see, I can use this here. So I've got this little checkerboard pattern here, and this is going to test for any floaters of your vision. So if you've ever been dizzy, or maybe if you've had some episodes of hypertension and you've gotten up too quickly and you kind of see stars around the room, if that's happening more frequently, this can kind of induce that. So what I'm going to do is have you look here. I'm going to have you look right at the middle of this black dot. I'm going to move this around your visual field. I want you to tell me if at any point you start to see any floaters of the vision, any stars. Okay, so I'm just going to keep looking here. I'm going to come very close and then very far. And you let me know if at any point you see any double vision, blurry vision, if you can no longer see the black dot or if it turns white. Any issues so far? Good. So I'm going to have you do the same thing. I want you to keep looking here. This time I'm going to cover one of your eyes. So we're going to test independently. So we're going to come close and then far. Any issues there? Good. Same thing, we're going to do this side, so I'm just going to have you turn your head slightly. We'll go like this. Any issues on this side? Good. Okay, very good. So go ahead and put this away, and then I'm going to do just a very brief check for your color deficiency. You didn't have any abnormalities on that last one, but I'm going to go ahead and test this because I did see that inflammation. I want to make sure we're not putting any pressure on your optic disc. So just, let's see. All right, so you should see a set of numbers here. Can you read that out loud for me?
29.
In here.
74.
Good. See anything here? Good. Test some.
35. 96.
Very good. We'll do one more. Make sure we test red and green. Anything here?
45.
Good. Okay. So I don't think there's anything wrong really with the optic disc itself, aside from just a little bit of that inflammation, which I will check further. So we can take a break from the eyes for a second. And I'm going to go ahead and check your ears. I just want to have a bit of a look inside the ear. Have you had any issues with like pressure of the ears or any abnormal earwax or pain of the ears, anything like
Just sometimes ringing.
ringing on the only on the left side? Okay. Does that occur when all of the other symptoms are happening, or is it just kind of intermittent?
Here and there, but when my allergies kick in.
Okay. So it could be that there's just builds up pressure, or just make sure that there's no damage to the tympanic membrane or your eardrum. So I'm just going to have a look inside your ear. So if you turn your head for me. I'm just going to move your hair out of the way here for a second. All right. So I am going to pull up and back on your ear, and then you're going to feel me come in. And it's going to tickle just a little bit. Have a look inside. Tympanic membrane is visualized. Your ear is actually nice and clear. No signs of earwax at all, really. Also no abnormal debris. I don't notice any excess dead skin cells. And no abnormal discoloration. It's nice and pearly gray. Okay, this side looks really good. So we did see a little bit of inflammation on that left ear. And then you said you've been having the ringing, so I am going to perform a hearing test and see if there's any issues with your hearing, if there could be any occlusion. But... okay. Now, you said you've been having issues with your allergies, but I know that's kind of chronic for you. Any like stuffiness or occlusions of the nares or issues with your nose, issues with smelling or smelling things that you think are maybe abnormal, any smelling of smoke, anything like that?
No.
Just kind of normal stuffiness?
Yeah.
Okay. So I'm first just going to have a look, and then I'll do a little bit of palpation. Okay. So now if you tilt your head just very slightly. Just look for any signs of irritation. So I do see just a little bit of redness right at the base of the nair. Doesn't look too bad. I don't notice any deviation or anything, so just very mild inflammation there. Okay. So I'm going to have a look at your throat as well. If I can have you just open for me. And if you can say, very good. You can let midline, nice and even. Maybe mild inflammation at the back of the throat, actually. If you can lift your tongue up for me to the roof of your mouth. Soft palate looks good, though. And then smile with your teeth. Just looking for any inflammation of the gums. Oh, you've got a gem on your tooth. Is that permanent jewelry that you've had placed there?
It's just with like the dental.
Is it like resin?
It's the same thing they use for braces.
Okay. So it does look good. It doesn't look like it's caused any damage or anything to your tooth. Very nice. Okay. I assume you've had that done professionally? Okay.
Had it done about 3 years.
Okay, good. I didn't notice that on your last examination. I don't think I must have overlooked it. I'll just take a quick note there just so I have it on your file. So that is your right. Let's see one more time. Third, okay. Right, third. So for medical purposes, we document that you have a cosmetic implant. Okay. All right. So let's go ahead and move on. I think at this point, we should go ahead and perform some of our palpation assessment. So I'm going to put on a pair of gloves. I'm going to be feeling around your face a little bit. I'm going to start by feeling up at the scalp, if that's okay with you. So I'm just going to have a feel around your head. So I'm just going to feel, if you could just turn your shoulders just slightly for me. Perfect. So you let me know if any of this causes you any tenderness. So we're kind of looking for any signs of inflammation here. So I'm going to start with bilateral palpation. So you can tell me if this feels different comparatively on either side, or if that feels about the same.
About the same.
Okay. And if we come kind of centered here, does that feel about the same? Okay. And then at the top of the head, any soreness or inflammation kind of sensation here?
No.
And then back of the neck, does that feel about the same on both sides? Okay. So now I'm just going to palpate around and see if I notice any symptoms of inflammation or any signs of swelling. Feeling for any lumps. Like to feel along the cranial structure, see if there's any ridging. It's pretty smooth. Okay. All right, and then I'm just going to feel right along the forehead here. So just feeling along the hairline. Sometimes get some inflammation here, but I don't think I feel anything earlobe. Behind the ear, is there any pain or pressure along that mastoid process?
No.
No, sometimes there can be a buildup of inflammation there, but that just feels okay. Just coming down clavicular line. Maybe a mild palpable node there, actually. Okay. So it's about 3 finger spaces in from the right side. All right, and we'll do the same on this side. Any tenderness at that left ear?
No.
And then again behind the ear here.
No.
Coming down the clavicular line once again. Again, maybe just some mild inflammation there. So, interesting. Okay. So I am feeling some distension at the nodes for sure. I want to do a deeper palpation here. That does feel just a little bit abnormal. Okay, so we're going to come back to that. I do want to do a bit more of an in-depth examination of your nodes. I do feel some inflammation there, so I'm just going to take a quick note. We're going to do a secondary assessment of the nodes. So I'll test some of these other functions and then we'll come back and we'll palpate a little bit more there. Okay. All right, in the meantime, I'm going to have a look at your hands. So just going to feel around at the veins, feel for any signs of inflammation at the joint. Do you ever have any issues with your joints, with your hands, any kind of swelling or?
No swelling.
Good. Nice and soft. I don't feel any rigidity. Skin itself is very smooth to the touch. Nice and well moisturized. I'm going to check for capillary refill at the back of your finger since you do have nail enhancement. So very normal return there. Nice and healthy blood flow. Don't notice any signs of lack of circulation there, so that's good. All right. That feels okay. So I'm just going to kind of squeeze along your arm here. Just want to feel for any hardness, any swelling. Checking for any third spacing or edema. That does feel okay. Arms are just a little bit cold. Hands are warmer. That can be. No, is it okay if I move your sleeve a little bit? Just gonna roll this up slightly. So I do feel just a bit of temperature variation. So here at the shoulder, you're actually quite cool to the touch. A little bit warmer as we come down. A little bit of variation, nothing that looks like it's out of range. So just something to note there. Okay. All right. So I'm just going to feel your pulse while I'm here. Nice and strong. Don't feel any arrhythmia. It's very steady. Okay. I'm going to feel at the wrist as well. Again, nice and strong, very steady. Good. Okay. All right. Okay. So I'm going to go ahead and check reflexes on this side while I'm here. So I'm going to test on this side. I want you to just kind of allow me to take the full weight of your arm here. It's going to feel a little tickle. Good. Good. Okay. Of course, I'll check that on the other side when I come around. Check some facial reflexes as well while I'm here, though. So I'm just going to move your hair slightly from your forehead. All right, so you're going to feel some mild tapping at the eye. It's going to feel just kind of like this, very soft. Don't have to do anything. I want you to keep your eyes open, but don't hold them open. So just allow yourself to blink, okay? I'm seeing maybe a bit of a mild overreaction on that left side. Left side is giving me just a little bit of an abnormal reaction, so I will retest that when I come over. I'm going to have you hang your jaw just kind of loosely open for me, so it's separated at the teeth. Good. Okay, good. All right. So just have a little brush here. It's kind of, just give you an example, it's just kind of wiry. It doesn't hurt. It's just a little scratchy. So I'm going to do the same thing. Is it okay if I have you take your glasses off for just a second? So I'm going to do the same thing. I'm going to come just a little bit closer to the lash line. So again, just allow yourself to blink, okay? It's definitely a normal reaction on the right side. Nice and responsive. I'm not getting like an oversensitivity or a tearing of the eye. Looks good. I'm going to touch your lashes. Very good. Just going to test that on the left side. So. Let's see, just a little bit of. Do you feel any twitching or pulsation underneath your eye there? Mm-hmm. No? Okay. All right. Have you keep your glasses off for just a second. I'm going to go ahead and just put this back. Okay, so I have kind of a pressurized tool here. I'll just show you what it feels like. So it just gives a little bit of pressure. So I'm just going to kind of come closer here and I'm going to apply some mild pressure at different areas of your eye. Let me know if any of this causes you pain. See a little pocket of swelling here below the left eye. Maybe just a little bit of fluid buildup. It could be related to the allergies. I see something there. above the brow as well. Does that cause you any pain?
No.
Just some mild inflammation there. Do the same thing on the right side. Okay, all right. Go ahead and relax. Coming back in at the top of the cranium, Erika, I'm just going to move your hair slightly out of the way as I perform my secondary palpation assessment. I did notice a little bit of swelling, so I want to feel around a little more and see if we can kind of isolate where some of that inflammation is coming from. I want to rule out whether this is it's like a compression of the cranial nerve because of some of that inflammation, or if it's just kind of anomalous. So I'm just feeling around, just kind of a flat-handed pressure here. Just gonna feel in a couple different areas. So maybe some mild inflammation at the base of the skull. Mostly on that left side, which I know you said is where some of that pain was isolated, or some of that, not pain, but kind of tingling and inflammation. So just feeling there. It does feel just a little bit swollen to me. So then I'm going to come down and feel here just below the cheekbone. Sinus inflammation. I'm just going to palpate right along that sinus cavity. Do you feel any pressure here?
Mm-mm.
No. Just palpate along the gum line. As I come down towards your lymph nodes, definitely feel a little bit of that inflammation here. Couple palpable nodes. Submandibular, submental. Okay. As I come down along the chest, I'm going to feel supraclavicular. I did feel a node there that was palpable. And I can still feel it here on that right side. So we're about 3 spaces in there. So palpable node there. Supraclavicular. Okay, so I feel directly along the throat. Just compress gently here at the thyroid, bilirubinar pulsation, any abnormal inflammation or irritation, maybe some mild inflammation actually. I think I do feel a little bit there. Alright, so I'm going to come back up to the scalp. I think I want to perform a couple percussions here. Again, I want to feel for any inflammation, specifically at the top of the scalp. I tend to see a little bit of tenderness here. Percuss near the temporal region. It's not so much there. eyes closed for me, Erika. I'm going to shine my light here. Mild inflammation there. Certainly is worse on the left side. Same thing on this side. Again, I do just see a little bit of mild inflammation there, but it is kind of isolated to the external quadrant of the left orbital socket. And then maybe some edema here. And then maybe some inflammation here along the temporal region of the left side as well. So we do seem to have kind of a trail of swelling that I'm noting. Okay. Just going to shine directly over the center of your face, looking for any asymmetry at the nair. You don't notice top of the nose is midline to the forehead. Okay. Shoulders as well. Just gonna palpate here. So just a little bit tight, which could be related. Sometimes if we're having an inflammatory response, our body can kind of show signs of inflammation in the joints. Our shoulders tend to carry a lot of that tension. So I do feel a little bit of tightness there. Feels a little tender to you. Okay. All right, so I'm going to come over on this left side and have a bit of a closer look. I am on your left side, and I'm going to palpate a little bit more directly here. Isolate where I think this inflammation could be happening. So I'm going to alternate between palpating with my hands and maybe manipulation with a couple of tools. So you just relax for me. I am going to have you turn your head slightly to the right, if that's okay, so that I can have a better look here. Because you did say there was some ringing of the ears. I'm going to continue my palpation here below that left side. So palpating along your jawline, feeling along that mastoid process. I do sense some inflammation here as well. Just going to have a look. I don't notice any redness. Like the ear itself. So there is just a little bit of pinkening here at the external lobule, and then following up towards the cartilage. Maybe just a mild increase there, but it doesn't look too bad. As I come directly along the pinna, coming down towards the lobule. And then just along that mastoid process, for any signs of irritation here of the skin. It does look just a little bit inflamed internally. Just maybe some mild inflammation there as well. tool here to pull along the skin just very gently. Just let me know if that causes you any discomfort. I'm just pulling along, assessing some of that erythema. Just mildly inflamed here. And then as we come further down the neck, it does dissipate, but again, I do still just feel some inflammation. So overall, it feels like your body is producing, I would say, a moderate inflammatory response. You may be fighting some sort of internal infection, so it would be a good idea to do some labs, follow up with your blood work, and see if we test positive for any of the normal strap or flu. It is out of season, but not unheard of. Feel around at the shoulder. Inflammation at the clavicle. Feel some mild pressure build up here at the lower clavicle, just below your left collarbone. A little bit of inflammatory buildup there, so it could just be that your lymph nodes are not quite draining properly. Some of that lymphatic fluid may just be built up here in your chain of nodes, which can be common during allergy season. Your body's just having trouble working through the pollen, so just gonna feel to come in and perform a few tests for sensory dysfunction. Now, I'm still just not quite sure if this is a reaction to your cranial nerves being occluded by swelling. So if you have any inflammation or edema that's pushing on your nerve that is responsible for sensory function, then that could explain why you have some of these tingling sensations. Could also explain some of the ringing of the ears. So we actually have a secondary look inside of your left ear. So I'm just going to so just have my otoscope, and I'm just going to come in here and have a secondary look. So definitely still seeing that inflammation. Actually, you see a small, abrasion here. Which could be due to just some of the inflammation. I don't notice any excess earwax, but there is some mild discoloration of the ear canal. Okay. Definitely some swelling. Okay. I would say the tympanic membrane is normal. It's fairly gray. I don't notice any redness there. Just kind of the mid to shallow ear showing some signs of irritation. Okay. Alright. So I'm going to do those tests for sensory dysfunction. And I'm going to start with a very soft sensation. So I'm going to feel this tool. It's kind of like a soft, wispy cotton almost. And going to apply it to your skin, so you're going to feel a soft sensation. Good. Wisping across the skin, and I'm just looking for normal or abnormal reactivity of the nerves, the facial nerves that are responsible for sensory function. So just feel me touch your skin with this soft object, and I want you to just relax for me. I'm trying to get as natural of a response as I can. So I am seeing a bit of diminishment of reactivity here. It's not quite as responsive. And then if we just here at the lobule, just quick wispy motions. I do notice a bit of diminishment there as well. So that's interesting. So I'm just going to do some tracing along the meridians here. So I'm going to start at the forehead and come down towards the temple. And then temple towards the ear. And then ear towards the chin. So a bit of a triangular region here that is mildly abnormal in sensation. So let me follow that up with something a tad more distinct. So why don't we do, still in the family of softer sensation, I'm going to touch you with this sponge. So it's just mildly abrasive. I'm going to start again at the forehead. Let me know if you feel any of that tingling sensation, if you feel any abnormality in texture, if you start to feel any pins and needles. Again, I am noticing just a mild diminishment of sensory function here as well. Mostly on the lower third of your face. So I might actually look into getting an MRI done of the left side of your face. See how much of that compression is affecting cranial nerve 5. So just going to do some gentle percussion here before I test another. See if a little nodule there as well. Alright, so this time I'm going to come in with a sharper sensation. Can you feel that that's fairly sharp?
Mm-hmm.
So I'm going to move this down the forehead. I'm coming towards, the temporal region. Do you feel any kind of tingling or pins and needles here?
No.
And then as I'm next to the ear, do you feel anything here?
It's a little sharp.
A little sharp. Good. And down the jaw, does that feel fairly sharp?
A little bit, yeah.
Does it feel the same sharpness on this side that it does on that side?
Yes.
That's a good sign. So if I alternate this time using a similar sharp tool, this one is a tad more distinct. Can you tell that that's sharp?
Mm.
Can you tell that this is dull or soft? Okay. So I'm going to touch your face in various places. I'm just testing to see if it really is isolated to this lower left side. So I want you to tell me if you feel soft or dull versus sharp. Okay?
Soft. Soft. Sharp. Sharp. Soft. Sharp.
So now I'm going to test from one side to the other once again, and I want you to let me know if it feels any different from your left side to your right side, okay? So coming again with the soft, you're just going to feel kind of that wispy sensation, and this time I want you to let me know if there's any variable from the left or the right side. So now we're trying to do some isolation here, so does this here feel the same as this? And along the brow, does that feel about the same? Just below cheekbone, does that feel about the same? Then if we come here at the jawline, does that feel the same as that side?
A little more dull on this side.
Okay.
On the left side.
So then if I come from the right side around, do you start to feel that it feels different?
A little bit,
Okay, and that's kind of still isolated to that area. Okay, so I do see that there is some compression of the nerve, so I'm going to test just two more things here. I want you to tell me, do you feel vibration here? Okay. Do you feel vibration here?
A little bit.
A little bit. A little on that side.
Yeah.
Okay. Would you say that that side feels the same or different than this side? Different. Okay. Now, lastly, for the sensation of your face, I'm going to test just cold response from one side to the other. So same thing. I want you to tell me if it feels the same coldness on both sides. Okay. So here and here, does that feel the same? Either sides of the mouth, does that feel the same? And then below the ear, does that feel the same?
A little bit.
A little bit. And then as I come here and here, does that feel the same coldness?
A little less on the left side.
Less on the left side. With an identical object here, I'm going to touch you at the same time. I just want to confirm that does not feel the same temperature to you.
Correct.
Here it does. Here it does.
Yes.
Here it does not.
No.
Okay. So some definite compression on the left side. So we're going to go ahead and move on. I'm going to do a bit of palpation of the lower body. Okay? All right, Erika, so coming down to your lower body, I'm just going to do a couple of those palpations that we talked about. Feel around for any signs of inflammation or anything abnormal. So you're not really complaining about any signs of distension or anything at the abdomen. And then you said nothing really concerning of the lower extremities either. Okay. So I'm going to do some superficial palpation to start. You can let me know if any of this causes you any discomfort. So just feeling for any signs of bloating, signs of abnormal distension, or any hardness or like rigidity of the abdomen. So far all of this feels okay, nice and tender to palpation. I don't feel any like lumping, I don't feel any hardness. Just gonna feel around for any signs of umbilical hernia, which so far is not notable. I don't notice any distension. Some moderate palpation of the ribs for any signs of flaring. Nice and even at the rib cage, centered with the breastbone. So I'm going to go in for a deeper palpation here now. I'm feeling for the organs. So I'm just going to palpate around in a circular motion. This allows me to feel for any signs of inflammation of the internal structure of the abdominal cavity. So far as not notable. Feels okay. So I'm going to do some percussion, first just manually with my hands. Listening for any abnormalities, again, any signs of distension. Very good. If I could just have you take a deep breath in for me, Erika. Go ahead and release all the way out. Very good. Nice and even at the ribcage. That's good. So we can do some percussion with our secondary reflex hammer here. So we're just going to feel some tapping. Normal density at the rib cage. Sounds good. Same on this side. So always testing bilaterally, listening for any audible differences. The bony prominence, but that sounds okay. Now as I come centered with the abdomen, we'd expect a more hollow sound, which is notable. Less shallow towards the lower abdomen. Just going to percuss along the pelvic bone. You can let me know if any of that's tender. Good. Okay. All right. Looks okay. So not really noticing anything at the stomach. Looks good. So I'm going to come down and palpate along the lower extremity. So I'm going to feel your legs. Briefly feel at the thigh, feel for any signs of distension. It's not particularly notable here on that right side. Same on the left. So it does appear as if most of your symptoms are kind of isolated to the upper chest area. Definitely that lower mandibular. Just feel along the knee here. I don't feel anything at the joint. You never have any clicking or any pain or issues, inflammation at the knees. Good. Just coming down. Just feeling along the calf. Do feel a bit of temperature variation here at the skin. It's just mildly cool. And test while I'm here. Actually looks okay. Very consistent. Nothing abnormal. It is just a little bit lower than your baseline of 98.3. I'm getting an average of about 96.9, but you have been laying down, so not as much blood flow has been going to your feet, so that's it, right? So nothing concerning. Just gonna feel pulse here. Okay, nice and strong. I'm going to roll your pants up just very slightly, if that's all right. So I just have about a 6-inch area here, which is enough for me to test for sensory dysfunction. So I'm going to go in with our softer sensation. So just like we did up near your face, I want you to tell me if you feel that this is soft. Okay, so just have you close your eyes for me. Let me know if you feel soft. Good. So it's about equal on both sides. And if I come in with that sharper sensation, so same as near your face, you feel that this is sharp?
Yes.
Is there anywhere that it doesn't feel sharp? Feel the same on the side, sharp?
Yes.
Good. And then I'm going to test this last one bilaterally since we did see the dysfunction up near the face. So testing for cold. Can you tell that that feels cold? Is that equally as cold here?
Yes.
In here?
Yes.
In here?
Yes.
In here?
Yes.
Good. So none of that felt different one side to the other. Okay. All right, and then one last test. I'm just going to test for a little bit of peripheral neuropathy. So I'm going to slide this just kind of down your legs like this. I want you to let me know if you feel any tingling or like pins and needles. Okay? So start at the outside here. Anything there? And then if we come centered, and then internally. No burning sensation. Good. Okay. All right. Just pull your pant leg back down. If I could have you just push up with your leg for me. Just push up into my hand and then down. And then up here and down. Very good. Oh, that feels so good. All right. So I'm going to come back up and we'll kind of finish up our assessment, okay? All right, Erika. So I am going to go ahead and document those findings. Now, I did see what I would consider some moderate inflammatory response. You do have some swelling of the nodes, specifically on the left side. I did also see a lot of distension, kind of lower mandibular area, so behind your ear and kind of along your jawline, and then there definitely was some sensory dysfunction. The good news is that I don't think it's cranial dysfunction. I don't think there's anything wrong with your cranial nerve. I think it's more so just due to inflammation. So I do want to follow up and get some labs done if that's okay with you. So we'll do some blood work for sure, and then depending on how your labs come back, we're going to hold off on imaging for now. So if your labs end up coming back with anything out of normal range, then I am going to order an MRI to kind of have a look and make sure that there's not any excess compression there. Okay? All right. As far as the ringing of the ears, I want you to just watch your symptoms. If you notice that you start to have any like drainage or anything like that, definitely let me know. So for now, we will go ahead and follow up with the blood work. And I am labeling your sensory dysfunction as moderate because there was just a little bit that was concerning to me there, specifically with your bilateral sensation response. So, all right. Do you have any questions for me?
No, I think that's it for now.
All right. So if it's all right with you, I'm going to go ahead and have our lab tech come in. She will get your labs done, and then we'll send that off, and your results will come in usually in about a week or two. Okay? Of course, if your symptoms start to get worse, definitely let me know. We can maybe get you in for a secondary assessment and see if anything's gotten worse or if you're just not quite getting better, though. Okay?
Okay.
All right. Let me go put this in. She should be coming in shortly.
All right. Yeah, thank you.